Sarcomas is a group of malignant tumors that either can originate from bone or are soft tissue. And by soft tissue, I mean muscle, blood vessels, fat, or nerves. And that soft tissue is anywhere in our body, from our head to our toes. And it is a rare disease. It represents less than 1% of all adult cancer seen in the United States each year. Moreover, what complicates or challenges us the most is that there's not just one type of sarcoma. To date, there's approximately 150 types of sarcoma. The challenge of this disease, number one, it's because of its rarity, they get undiagnosed or misdiagnosed initially, and or if appropriately diagnosed, they're not routinely seen in the community, and therefore how best to treat them is quite nuanced. At Winship, I think what sets us apart is really that multidisciplinary team with expertise in sarcoma. We have a group of providers and team members that are purely dedicated to this disease. And those team members range from sarcoma pathologists, from medical oncology, radiation oncology, surgical specialties, musculoskeletal radiologists, rehabilitation teams, and supportive oncology teams, all focused on treating patients with this specific malignancy.
Every patient with sarcoma gets presented at our tumor board, and we essentially are creating an individual treatment algorithm for every single patient. It is very rare to have all of this expertise under one building and being able to provide the multidisciplinary care that sarcoma requires.
For the majority of soft tissue sarcomas, surgery plays a critical role and is the backbone in the treatment of this disease. But absolutely, depending on the subtype, there is this multidisciplinary treatment plan, whether it is chemotherapeutics or immunotherapies that come into play, depending on the sarcoma subtype that you have, or is it radiation that comes into play and how best to treat this tumor. And the advantage of having a proton center within the Winship Cancer Institute, allows us to use the modality of radiation in a safer manner where we would minimize the toxicity and injury to critical organs that we want to preserve. As we've built the program around this rare disease, we have been fortunate now to be able to have a home for this program within the Winship at Emory Midtown facility, where we have on a weekly basis a multidisciplinary clinic where the sarcoma medical oncologist, the sarcoma radiation oncologist, and the sarcoma surgeon are having clinics in parallel, seeing these patients with this rare disease, allowing us to streamline and move the patient through their cancer journey more effectively and more efficiently.
And you should come to a place where not only are we seeing patients with this issue regularly, but we're driving the treatment of this disease so that we can not just cure you, but cure the next person with this disease.